Have you noticed how something that once felt effortless and natural doesn't respond the same way anymore, even when you're doing everything the same as before? That quiet shift can feel confusing, even a little frustrating, especially when you can't quite explain why it's happening. My name is Dr. James, and for many years I've worked closely with men over 60, helping them understand and support their bodies as they go through these natural changes. My focus has always been on restoring confidence and clarity in a way that feels respectful and grounded. What I see time and time again is that many men are quietly going through the same experience. They rely on habits that once worked well without realizing that the body has already begun to respond differently at this stage of life. It's not a failure, it's simply a signal that something needs to be adjusted. In this video, I'll walk you through what's actually happening beneath the surface and how you can begin to support your body in a more effective, natural way. We'll focus on restoring comfort, steadiness, and a sense of connection with your own body again. And by the end, you may realize that the real issue isn't what you thought it was. It's something much more subtle and far easier to address once you know what to look for. 1. Eugenol, the natural compound supporting your circulation. When we look closely at what changes as men move past 60, it is often not a sudden decline, but a gradual shift in how the body responds. You may still feel the same intention, the same desire to stay active and independent, yet your body does not always follow with the same ease it once did. This can quietly affect confidence, and even create an unspoken worry about whether things are just getting worse, or if something is being missed. In my experience working with older men, many of these concerns are connected to one central factor: circulation. As blood flow becomes less efficient with age, it can influence energy, recovery, and overall responsiveness of the body. This is where natural compounds like eugenol, found in clove, become relevant in a meaningful and supportive way. Eugenol is known in clinical discussions for its ability to support vascular relaxation, which simply means helping blood vessels remain open and flexible. When circulation improves, the body can deliver oxygen and nutrients more effectively, which supports multiple systems at once. For a man in his 60s or beyond, this is not about chasing youth, but about restoring a sense of steadiness and function that feels familiar and reassuring. However, it is important to understand when and how to approach this. Eugenol is most supportive when used in small, controlled amounts as part of a consistent routine. It is not meant to replace medical care or prescribed treatments, especially if you are managing conditions such as high blood pressure or are taking blood-thinning medications. In those cases, professional guidance is essential before making any changes. Many men I speak with quietly worry about losing control of their health or becoming dependent on medications. This concern is real and deeply human. The key is not to force the body, but to support it gently and consistently, allowing it to function the way it is still capable of. When used appropriately, compounds like eugenol may complement this process by supporting circulation, which is often at the root of many age-related changes. As we move forward, I will show you how this simple compound connects to a broader pattern in the body, and why understanding that connection can help you avoid one of the most common mistakes men make at this stage of life. 2. Why erections get weaker after 60. As we continue, it's important to speak honestly about something many men over 60 notice but rarely discuss out loud. At this stage of life, even small changes in how the body responds can feel deeply personal. There is often a quiet concern in the background, wondering whether what you're experiencing is normal aging or something more serious that you might be missing. From a medical standpoint, the changes you are noticing are often related to the cardiovascular system. As we age, blood vessels naturally lose some of their flexibility, and the lining of the vessels can become less responsive. This affects how efficiently blood moves through the body. Since strong physical responses depend heavily on proper circulation, even a slight reduction in blood flow can lead to noticeable changes over time. Many men assume this is something they simply have to accept. However, what often goes unspoken is that lifestyle factors such as chronic stress, reduced physical activity, and even long-term inflammation can accelerate this process. When these factors combine, they can quietly interfere with the body's natural ability to maintain healthy function. It's also important to understand that not all situations are the same. Some men may be dealing with underlying conditions such as high blood pressure, diabetes, or side effects from medications. In these cases, the body's response can be even more sensitive, and it becomes especially important to approach any change with care and awareness rather than assuming one solution fits all. One of the deeper fears I hear from men is not just about physical performance, but about losing a sense of identity and confidence. It can feel unsettling when the body no longer responds the way it once did, even in moments that should feel natural and familiar. That emotional weight is just as important as the physical changes themselves. If this is something you recognize in your own life, the most important step is not to panic, but to understand what your body is trying to communicate. Small, consistent adjustments, especially those that support circulation and overall vascular health, can make a meaningful difference over time, but knowing where to begin is often the hardest part. And that brings us to something practical and simple, a method that many men find surprisingly effective when applied correctly and consistently, which we will explore next. 3. How to do the 60-second clove method. Now that we understand how age-related changes in circulation and vessel responsiveness can affect the body, it's important to focus on something practical and simple that many men in their 60s and beyond can safely incorporate into their daily routine. At this stage of life, there is often a quiet desire for solutions that feel natural, manageable, and respectful of the body, rather than overwhelming or dependent on complex interventions. This method involves a familiar spice used in many households, and the approach itself is intentionally gentle. You are not trying to force a reaction from your body, but rather to support it in a way that works with your natural physiology. For men who are already managing chronic conditions, taking medications, or experiencing sensitivity in the mouth or gums, it's important to approach this with awareness. If there is discomfort, irritation, or uncertainty, it should not be forced, and consulting a healthcare professional is always the safest path. What makes this approach meaningful is not just the ingredient itself, but how it is used. By allowing the natural compounds to be released slowly in the mouth, the body has an opportunity to absorb them in a gradual and controlled way. This is particularly important for older adults, as the body becomes more sensitive to both beneficial and irritating substances over time. Acting too aggressively or rushing the process can reduce effectiveness and may even lead to discomfort, especially for those with dental concerns or oral sensitivity. Many men quietly worry about whether they are doing things right when it comes to their health. That concern is valid because small mistakes, such as overuse or improper timing, can sometimes lead to irritation or unnecessary stress on the body. The goal here is not speed, but consistency and gentleness. If you choose to try this approach, the most important thing is to listen closely to your body's response. Pay attention to how you feel during and after, and avoid pushing beyond what feels comfortable. Health at this stage of life is less about intensity and more about balance and awareness. And as you begin to think about when and how your body responds best to these kinds of supportive habits, timing becomes just as important as the method itself, which we'll look at next. 4. Why most men don't see results. Common mistakes. Continuing from the previous step, it's important to understand why some men in their 60s and beyond try different approaches yet feel disappointed when nothing seems to change. At this stage of life, many men are quietly carrying a deep concern, the fear that their body is no longer responding the way it used to, and that nothing can bring that vitality back. This fear is often not spoken aloud, but it sits in the background during everyday moments, especially when health begins to feel unpredictable. One of the most common issues is misunderstanding how the body actually responds to support. When someone expects immediate or dramatic changes, they may become frustrated and stop too early. The male body, especially after 60, does not operate on quick reactions anymore. Circulation, hormone signaling, and nerve sensitivity all work more slowly, and forcing faster results can actually interfere with the natural process. This can create a cycle where men try something, don't see results, and begin to feel discouraged or even doubt themselves. Another concern is overdoing it. Some men believe that if a little is good, more must be better. However, at this age, the body becomes more delicate and sensitive. Overuse can lead to irritation, especially in the mouth or digestive system, and in some cases, it can even cause mild inflammation that works against the very goal they are trying to achieve. This is especially important for those who are already managing conditions like high blood pressure, diabetes, or are taking daily medications because their system is already under careful balance. There is also a quiet, emotional burden tied to these experiences. Many older men worry about becoming a burden or losing independence, and when a health approach doesn't work, it can feel like another small loss of control. That feeling can lead to stress, and stress itself can further impact circulation and overall function, making the situation even more difficult. Understanding these patterns is essential. When used correctly, with patience and awareness, the body can respond in a more stable and natural way. But when rushed, misunderstood, or overdone, the results may not only be limited, but could also create additional strain. As we move forward, the next step is to focus on how to recognize the subtle signs that your body is actually responding, even when the changes are not immediately obvious. 5. What your body is trying to tell you. Building on the idea that results take time and must be interpreted carefully, this next step is about something many men in their 60s rarely talk about but deeply feel: the uncertainty of whether their body is still capable of responding at all. At this stage of life, it is not just about physical function, but also about the quiet fear of losing control over one of the most personal aspects of health. This concern can feel isolating, especially when it seems like the body is no longer giving clear or predictable signals. In reality, your body is still communicating, just in more subtle ways than before. Reduced responsiveness does not always mean failure. It often reflects changes in circulation, nerve sensitivity, and hormonal balance that occur naturally with aging. However, many men overlook these signals because they expect the same patterns they had decades ago. This misunderstanding can lead to frustration, self-doubt, and even a sense of aging faster than expected, which can quietly affect confidence and emotional well-being. There is also a meaningful connection between how your body feels and how you interpret those sensations. For example, if you feel slight changes in responsiveness or energy, that can actually be a sign that your system is still capable of responding, even if it is slower than before. Ignoring these subtle signs or assuming the worst can increase stress, and that stress itself can interfere with circulation and nerve function, creating a cycle that is difficult to break. On the other hand, if these signals are noticed early and respected, they can guide you toward better choices. This does not mean pushing harder, but rather paying attention to consistency, timing, and how your body reacts over days and weeks instead of expecting immediate outcomes. Many older adults find that when they shift their focus from urgency to awareness, their body begins to respond in a more stable and reassuring way. The most important step is to listen without judgment. Your body is not working against you, it is simply changing. And when you begin to understand those changes, you can start to work with your body instead of against it, which naturally leads us into the final part, where everything comes together into a simple, sustainable approach you can trust. 6. The right way to support your body safely. Following the awareness you've just developed about listening to your body, the next step is learning how to support it in a way that feels safe, controlled, and respectful of your age. For men over 60, this is often where quiet hesitation appears. There is a concern that trying something new might interfere with medications, worsen an existing condition, or simply not work at all. That hesitation is not a weakness. It reflects a lifetime of responsibility and a desire to avoid unnecessary risk. At this stage of life, your body is more sensitive to change than it was in your 40s or 50s. Blood pressure, heart function, and circulation are no longer as flexible as they once were, and even small adjustments in daily habits can have noticeable effects. Because of this, it is important to approach any supportive method with patience and moderation. Rapid or aggressive changes may overwhelm your system, especially if you are already managing conditions like hypertension, diabetes, or cardiovascular concerns. What may seem like a simple step can become complicated if not introduced carefully. There is also an emotional layer that many older men quietly carry. The thought of losing independence or becoming reliant on others can create a sense of vulnerability. When health begins to feel uncertain, it can trigger a fear of decline that is difficult to express. This is why taking safe, measured steps is so important, not just for the body, but for peace of mind. The key is to integrate any new habit slowly and observe how your body responds over time. This is not about forcing results, but about creating conditions where your body can respond naturally and safely. Paying attention to changes in energy, comfort, and overall well-being allows you to make informed decisions without putting unnecessary strain on your system. If at any point something feels uncomfortable or unfamiliar, that is your signal to pause and reassess rather than push forward. This careful approach protects your health while also preserving your confidence in your ability to manage it. And as you begin to apply this understanding, you'll be ready to bring everything together into a simple, clear routine that supports your body consistently and safely moving forward. 7. Why timing matters more than you think. As you continue applying these supportive habits, one of the most overlooked factors is timing, especially for men over 60 who are trying to regain a sense of stability in their health. At this stage of life, many quietly worry about whether their body still follows a predictable rhythm, and when it doesn't, it can feel unsettling, even discouraging. This concern is not just physical, it touches a deeper fear of losing control over one's own body and daily life. In reality, your body still operates on natural cycles, but they may no longer align with the patterns you were used to decades ago. Hormone levels, blood flow, and nervous system responsiveness all fluctuate throughout the day, and these changes become more noticeable with age. When support methods are used at the wrong time, they may not produce the desired effect, not because the method is ineffective, but because the body is not in the right state to respond. Many men make the mistake of expecting immediate results regardless of timing. And when that doesn't happen, they begin to doubt the process or themselves. This can quietly lead to frustration and stress, which only makes it harder for the body to respond naturally. On the other hand, when timing is respected, even small efforts can feel more aligned and effective, creating a sense of reassurance and control. Understanding when your body is most receptive is not about strict rules, but about observation and patience. It's about recognizing patterns in your energy, comfort, and responsiveness over time, and adjusting your approach accordingly. This awareness allows you to work with your body rather than against it, which is especially important as you age. And when all these pieces come together, timing becomes the bridge between effort and real, sustainable results, leading naturally into the final step where everything is simplified into a clear and meaningful conclusion. As the body ages, small changes can quietly shape your health in the next 1 to 5 years. Ignoring early signs may lead to greater decline, while understanding and adjusting early helps preserve strength, dignity, and independence. True protection comes from awareness, gentle action, and respecting your body every day.